Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everybody. Our lecture today about autoregulation of blood flow and coronary blood flow. First of all, we must know the objective of this lecture. At the end of this lecture, you should know the theories explain the autoregulation of local tissue blood flow, the pressure gradients and flow in the coronary vessels during cardiac cycle, the factors that control the coronary blood flow. What is the autoregulation of local tissue blood flow? In any tissue of the body, an acute increase in arterial pressure causes immediate rise in blood flow, but within less than a minute, the blood flow in most tissue return almost to the normal level, even though the arterial pressure is kept elevated. رغم ارتفاع الضغط يبدأ الجريان في النسيج بالازدياد، لكن في أقل من دقيقة يتم تنظيم الأمور ويعود معدل الجريان إلى مستواه الطبيعي. The return of flow toward normal is called autoregulation of blood flow. هذا يسمى عودة الجريان إلى مستواه الطبيعي، يسمى autoregulation of blood flow. You can note in the figure that an increase in blood pressure from 70 to 175, which is about 150% increase, not increase the blood flow more than 30%. نلاحظ من المخطط أو الكيرف الأفقي يمثل الارتريال بريشر، العمودي يمثل البلد فلو، معدل جريان الدم في النسيج. زيادة الضغط من 70 إلى 175، وهي زيادة أكثر من مرة ونصف في الضغط. 70 زائد 70 140 زائد نصف 70 35 يصبح 175. زيادة بالضغط من 70 إلى 175 زادت لنا فقط معدل الفلو 30% فقط، وهي زيادة قليلة نتيجة autoregulation of local tissue. So, what are the theories behind autoregulation of local tissue blood flow? First, the metabolic theory. According to this theory, the greater the rate of metabolism, or the less the availability of oxygen, the greater the rate of formation of vasodilator substances. The vasodilator substances then are believed to diffuse through the tissue to the precapillary sphincter and arterioles to cause vasodilatation. What is the precapillary sphincter? The precapillary sphincter is a smooth muscle at the arterial side of the capillary. These vasodilator substances diffuse to the precapillary sphincter and cause vasodilatation. What are these vasodilator substances? They include adenosine, carbon dioxide, adenosine phosphate compounds, histamine, potassium ion, and hydrogen ion. In summary, when blood flow to the tissue is decreased, vasodilator substances increase and lead to vasodilatation. And when the blood flow is increased as a result of this vasodilatation, these substances will be washed away, lead to vasoconstriction. من يقل عندنا البلد فلو راح تتجمع عندنا بالتشو vasodilator substances تسوي vasodilatation، راح يزداد البلد فلو، راح تنغسل هاي الفازودايليتر substances، راح يقل عندنا vasodilatation ونرجع إلى الفازو constriction. The second theory is the myogenic theory. In this theory, sudden stretch of small blood vessels cause the smooth muscle of the vessel wall to contract for a few seconds. عندما يرتفع الضغط ويسوي stretching للwall of the blood vessels, the smooth muscles in the wall of the blood vessel will contract. Therefore, it has been proposed that when high arterial pressure stretch the vessel, this in turn causes reactive vascular constriction that reduce blood flow nearly back to normal. Coronary circulation. There are two main coronary arteries that supply the myocardium, arise from the sinuses behind two of the cusps of the aortic valve at the root of the aorta. First, the left coronary artery supplies mainly the anterior and the left lateral portion of the left ventricle. The left coronary artery divided into the circumflex artery and left anterior descending artery. The second artery is the right coronary artery. Supplies most of the right ventricle as well as the posterior part of the left ventricle in 80 to 90% of people. The resting coronary blood flow in the human being average about 225 ml per minute, 225 ml per minute, which is about 4 to 5% of the total cardiac output. This is a diagram of the epicardial, intramuscular and subendocardial coronary vasculature. We see here a special arrangement. There is epicardial coronary arteries which give branches, the intramuscular coronary arteries. These intramuscular coronary arteries penetrate the cardiac muscle and reach the subendocardial plexus. The intramuscular coronary arteries are compressed by the cardiac muscle during systole, and the blood flow to the subendocardial plexus decreased. Let's see the pressure gradients and flow in the coronary vessels during cardiac cycle. In the left ventricle, this is the cardiac muscle, and this is the intramuscular coronary artery. During systole, the pressure in the intramuscular coronary artery is equal to that in aorta, which is about 120. The pressure in the ventricle is more than that of the aorta, so the intramuscular coronary artery will be compressed and blood flow reduced. During systole, but in the right ventricle, the pressure in the intramuscular coronary artery is 120, which is that of aorta, while the pressure in the ventricle is 25. The right side is lower pressure than the left side, so no compression on the intramuscular coronary artery on the right ventricle. During diastole, both ventricles, pressure in the intramuscular coronary artery is 80, equal to the diastolic pressure in the aorta, while in the ventricle the pressure is 0. Let's see the pressure difference during systole and diastole. In the aorta it is 120, In the left ventricle 121, so the pressure difference is -1 and no flow because of compression of intramuscular coronary arteries. During systole in the right side, the aorta is 120, right ventricle 25, difference is 95, so flow continue. During diastole, the pressure in the aorta is 80, while in the left ventricle is 0. The difference is 80 and the flow continue. In the right side, aorta pressure is 80, right ventricle is 0, pressure difference is 80 and the flow continue. Control of the coronary blood flow. First, local chemical factors. These local chemical factors includes adenosine, potassium ion, hydrogen ion, carbon dioxide, and bradykinin. Local muscle metabolism is the primary controller of coronary blood flow. الأيض هو العامل الرئيسي اللي يسيطر على كمية coronary flow. Blood flow through the coronary system is regulated mostly by local arterial vasodilation in response to cardiac muscle need for nutrition. That is when the contraction is increased, the rate of coronary blood flow also increased, and when decreased cardiac activity is accompanied by decreased coronary flow. The other factor is the neural factor, which include sympathetic nervous system and parasympathetic nervous system. The neural factors include the parasympathetic and sympathetic nervous system. The parasympathetic has direct effect and indirect effect. The sympathetic also has direct and indirect effects. Stimulation of the autonomic nerves to the heart can affect coronary blood flow both directly and indirectly. What I mean by the direct effect? The direct effect results from action of the neurotransmitter acetylcholine, norepinephrine on the coronary vessels. The indirect effect results from increased or decreased activity of the heart. التأثير المباشر ينتج من تأثير النورابinephrine or acetylcholine على البلد فيزل اللي هو الكورونري. indirect effect ينتج عن الاكتيفيتي of the cardiac muscle. إذا كانت الاكتيفيتي of the cardiac muscle عالية راح يصير عندي تجمع of active metabolite راح يسوي عندي vasodilation. إذا قلت الاكتيفيتي مالت الهارت muscle راح يقل الفازودايليتيشن because no more vasodilator substances. The effect of sympathetic nervous system include direct effects and indirect effects. The direct effects of sympathetic nervous system on the coronary arteries: vasoconstriction, slight vasoconstriction. In fact, why there is vasoconstriction? When a sympathetic neurotransmitter reaches the vessel, it may cause vasoconstriction or vasodilation according to the type of receptors on that blood vessel. If the blood vessel has beta receptor, the effect will be vasodilation. If the blood vessel have alpha receptor, the effect will be vasoconstriction. What about the coronary artery? The coronary artery in fact has both alpha and beta receptors, and the net result is slight overall vasoconstriction. What about the indirect effect of sympathetic nervous system? The indirect effects are, mostly opposite to the direct effects. The sympathetic stimulation cause increase heart rate and increase contractility and increase the rate of metabolism of the heart. This increase in metabolism set off local blood flow regulatory mechanism for dilating the coronary vessels. يعني sympathetic nervous system يزيد activity of the heart، يزيد الهارت ريت، يزيد الكونتراكتيليتي، يزيد الميتابوليزم بالهارت، راح يسوي لنا local tissue factors، راح يزيد لي vasodilator substances، والnet result is vasodilation. Which is stronger, the direct effect or the indirect effect? Whenever the direct effect of the nervous stimulation alter the coronary blood flow in wrong direction, which is vasoconstriction, the metabolic control of coronary flow usually override the direct coronary nervous effect within seconds. يعني الدايركت افكت يحاول يسوي vasoconstriction وهذا الشيء غير محبب لدينا، وعندما يحاول الدايركت افكت يسوي vasoconstriction the indirect effect override يتغلب عليه ويخلي عندنا يصير vasodilation. The parasympathetic nervous system has direct effect and indirect effects. The direct effect represented by vasodilation. We need to discuss something here. The distribution of parasympathetic nervous system اللي هو الفيغاس nerve to the ventricular coronary system is not very great. مو هواي واصلة parasympathetic إلى blood vessels. Blood vessels mainly depend on sympathetic innervation. However, the acetylcholine released by parasympathetic stimulation has a direct effect to dilate coronary arteries. The indirect effect of sympathetic nervous system mostly opposite to the direct effect. Vagal stimulation will slightly depress the cardiac contractility. شوية يقلل من الكونتراكتيليتي. This decrease oxygen consumption، يقل من استهلاك الأكسجين، ولذلك indirectly constrict the coronary artery. So the indirect effect lead to vasoconstriction. This is the end of our lecture. Thank you for listening.